welcome back to our program. It's been a minute. NVISION Eye Center's Dr. Jonathan Pirnazar. Thank you for being back with us.
Thank you.
And we're going to be talking today about cataracts.
Yes.
And let's talk in general for folks in the age group, in this demographic, certainly in this community, everybody knows someone or has had the surgery themselves or is going to have the surgery themselves. Why do cataracts develop in the first place?
Good question. You know, cataracts is a part, what I like to say, it's a sign of maturity. We all will get it. You know, it comes at different ages. You know, some people, I see patients coming in their late 40s, early 50s with some cataracts, you know.
Okay.
But the majority of reason why we get cataracts is really because as we age, you know. And so someone's coming in usually 60s, 70s, 80s, needing, you know, they're noticing blurred vision, harder to drive at night, road signs are not as clear, getting a lot of glare from oncoming headlights. Those are all signs of a cataract that's forming.
And is there something that we do as we grow to accelerate the need for a cataract surgery, or is there something people can do to protect and prevent? Is it wearing sunglasses and those kinds of things? Is it the simple stuff that you're told?
You know, it's not always.
Okay.
Not always. Sometimes I think UV protection is important, but it's not like a 1-to-1 ratio. It's not like if you don't wear sunglasses,
you're bound for it.
It's not that you're bound for it either. But I think there is some ideas that wearing sunglasses can't protect you from getting cataracts as you get older. But it's not 100%.
Now, it's a gradual thing, right?
Yes.
So some people, it's kind of like almost like a little bit of hearing loss. Like some people don't notice it, and everything's just, you know, I don't see as clearly as I used to. That's just a matter of age, but it's really not, right? It's a slow deterioration of the lens inside.
Absolutely. So as the lens hardens, as the lens kind of blocks more light, it is very gradual. Some cataracts do grow very quickly over maybe like 6 months.
Oh, okay.
That's one. Certain diabetics can get very quick growing cataracts, you know?
Oh, wow.
So diabetes is definitely a risk factor for cataracts, but the majority of patients who get the slow growing cataracts, those are ones where they don't notice it. But then the one thing I hear the most is you're driving at night. Oh, I can't drive at night anymore. Oh, the glare from the oncoming headlights. And they all complain about the new, you know, beams of the cars and stuff like that.
Which are truly, I mean, they're glary. Because I remember that you know, past 15, 10 years, it's like, wow, some of these headlights are really going at me.
Yeah. No, it's very true.
So what does a surgery actually correct? What does it help with?
Okay, great question. So basically your lens, which is right behind your pupil, which is your natural lens, it's clear when we're born, when that grows and gets cloudy, your natural lens, we call that a cataract. So a cataract is a clouding of your natural lens. So basically what we're doing is we make very small incisions, about 2.2 millimeters. We go in, we use lasers to create the incisions. We then go in, we vacuum out the cataract, and then we put a new custom lens in, and we have different lenses where we can get you both eyes for distance, both eyes for up close, to get you the most glasses free.
Okay.
We have other lenses that do just distance. You know, if someone was used to monovision, we can, where they wore contacts before cataract surgery, we can do one eye for distance, one eye for up close. So we have a whole range of options for patients to get them glasses free if they want, or if they still want to wear glasses, we can do that as well too.
Is there a lens that helps you find stuff in the junk drawer that you can never find?
Wait, say it again?
In the junk drawer that you can never find? Is there any lens for that, or the ones when your wife tells you to go find that?
Yes, so we have these special lenses where you don't need the reading glasses anymore.
Okay.
Yeah, we have these great lenses where you get both eyes for distance, driving, watching TV, no glasses needed. We have,
that's amazing.
And those same lenses can make it so you need glasses for your cell phone. So you can see your cell phone, you can see your iPad, you can see your computer, get you that freedom from glasses, and you don't need any glasses after surgery.
Now, there's certain levels of lenses, the quality and that kind of thing. Are there certain levels where the insurance will cover, and certain ones where, hey, some of this is going to come out of pocket?
Correct. Again, great question. The lenses that do the most, meaning they get you the most glasses free, they have the highest out-of-pocket for the patient above and beyond the insurance. Okay? So I kind of tier it like this. If a patient wants everything, you know, distance and up close without glasses, that's the most out-of-pocket that they would pay above and beyond their the coverage. Option 2, I say, is the option where we want to do just both eyes distance. You know, if they have some astigmatism, if we want to treat that. To treat astigmatism, where we set both eyes distance, I call that option 2, and that's an extra out-of-pocket cost as well, but it's less than the first one.
But I'm still going to need my readers for
Still
stuff.
need readers, exactly, exactly.
Okay.
And then the third option, I call that, is just the basic or standard lens. Great lens, you get great vision with that, but usually with the standard lens, you're going to still need glasses afterwards for both distance and up close, but you'll see much better with those new glasses after cataract surgery.
When a cataract very first starts, or when someone starts to notice it, is that the time for surgery, or is there a time where we really need to get it to this point? Is there any reason to wait?
It really depends. There are certain criteria that we look at. How thick the lens is. How dense is the cataract, number one. But also, what's the patient complaint? If you have a cataract and it's not bothering you, just because you have a cataract doesn't mean we have to take it out.
Okay.
But if you have a small cataract and it's right in the center and it's giving you a lot of glare at night, that could be an indication to do the surgery as well too.
Okay. Now, what should people expect when they go in? Do they do both eyes at the same time? Is it 1 and 1, or do we wait a little bit?
Usually I do it, again, most patients have similar cataracts in both eyes, so we'll do one eye 1 week, one eye the next week. And it's outpatient surgery. We have our surgery center right here in Laguna Hills, where we do one eye 1 week, one eye the next, and you do get a little bit of a twilight anesthesia, but you're kind of awake. You don't have any pain. There's no shots needed around your eyes. We just use numbing eye drops. And the best part is everybody loves the light show. You get a really good light show. Everybody goes, oh, I'm back in the 60s. This is good.
Good times.
Right.
Why do you usually have a separation between the eyes? Is there a medical reason for that?
I think just to be safe.
Okay.
Especially if you're putting in these special lenses that do both eyes distance, both eyes up close, you want to make sure they're happy with the first eye before you do the second.
Okay.
Yeah. That's what. But also just safety. You want to make sure, the risk of infection is extremely low with cataract surgery, but we want to make sure the first eye is good before you do the second.
Okay. Now, after the surgery, what's the recovery? Am I wearing special glasses for a little while? Am I kind of taking it easy for a few days? What's the healing process like?
I think really most of the special lenses we use, you just as long as you use your eye drops, the antibiotic, steroid, and the anti-inflammatory eye drops as directed, other than that, you don't have to really wear anything special. In the first couple of days, maybe the first week after each eye, you're going to have some light sensitivity, so wearing sunglasses will be needed when you're outside in the sun. But other than that, there's really not much to do.
Okay.
Yeah.
Now, there aren't any other options in terms of when someone has a cataract? There's nothing else. There's no alternative to cataract surgery, really, is there, to improve? So, I mean, this is either do it or live with the cataract, right?
Correct. Exactly. Yeah. There is no. I wish there was like a magic drug or an eye drop that can melt the cataract away, so you wouldn't need surgery. That would be amazing. And people are, I think, trying to work on that, but there's nothing that I have seen that's even close to even coming out. It's either do the cataract or wait to do the cataract.
Yeah, or push, keep kicking it down the road. Now, why some folks, is it just about nervousness, or they're not sure if they're ready for it? Is to kick it down the road for some folks?
I think, surgery it's a nervous thing, and it's your eyes. It's like, God, how's he going to operate my eyes? How am I going to keep my eyes open? And again, what I tell them is, listen, we have special eyelid holders that keep your eyes open, so you don't have to worry about that. You get a nice IV little medicine to make you relax, but we don't have to put you to sleep, so it's safe.
Okay.
And once I kind of explained to them that it only takes 7 to 10 minutes each surgery, so it's not long.
It's 7 to 10 minutes?
That's it.
Really?
That's as long as it takes, yeah.
I thought it was quite the longer procedure. I don't know why.
Yeah. And when I tell them that, oh, okay, that's good.
Okay, that's a little bit of relief,
Yeah, exactly.
And it is that, I guess there's that fear, of like, what if something, that kind of thing. But it's just, like you say, it's really kind of a routine process to this point of the advances in the lasers and all of the things you're using, right?
I think the technology has come a really long way. In 2011, we were one of the first places to use the laser for cataract surgery. So we have that. The technology of the lenses keeps on getting better and better. These special lenses that do both eyes distance, both eyes up close, we call them multifocal or lifestyle lenses. Those started in 2005, and now we're obviously almost 20 years later. They're much better.
Wow.
So the glare and halo risk is much less with these special lenses. The satisfaction is much higher. I would say probably, 90-95% of patients who get the special lenses would say that, hey, I'm really happy with it. I would tell my friend to do the same thing.
Well, let's get folks happy about doing this. All right. Dr. Jonathan Pirnazar from NVISION Eye Centers, thank you very much. The phone number is up on the screen for folks who want to know more and get in contact with you, as well as the website. Thank you very much for joining us.
Thank you. I appreciate it.
All right. When we come back, we'll be talking to folks from the India Club about their big dance party coming up. Stay with us.